everyone, and welcome to our first episode of Exotic Ward Conversations. My name's Sam, and this is Adam. And today we're going to be chatting about careers. So, first off, Adam, did you want to introduce yourself and who you are?
Yeah, of course. Thanks, Sam. And just want to start off by saying thank you very much for having me on today. So, firstly, for those of you that have already met me, I apologize. You probably heard me do this spiel a little bit before. But for those of you that haven't, as Sam says, my name's Adam. I'm an exotic veterinary nurse that's based over in the UK. I'm very lucky within my career that currently I'm the head nurse of UK's own exotics veterinary hospital with no dog or cat attachment, which is very niche here. Um, I've got lots of certificates after my names, which make me sound fancier than I actually am. I like the weird and wonderful. I like the exotics of the wildlife species. It's taken me to some very interesting places. I met some very interesting people, like Sam here. I've been doing that on and off now for over 10 years in varying different bits and pieces in veterinary and zoo.
Well, I first met Adam many years ago, actually, and he came over to both of our exotic veterinary training conferences. So, really, really exciting that he's been able to do that and join me on the podcast as well. So if you are extremely new to exotic vet nurse training, I should probably introduce myself. I'm Sam. I'm the owner, and we've been running for about 5 years now. I've got about 20 years of vet nurse experience in general practice, emergency, ICU, exotic only, and in zoos as well. Just taking a little bit of a break now to focus on exotic vet nurse training. I've got 4 books coming out in the next few years. So keep an eye out for those ones. I also just wanted to introduce you to Exotic Vet Nurse Training. Even if you have been following us, we are having a really big year ahead of us. We've got 4 textbooks coming out, but we've also got this podcast we're just starting. We've got 12 webinars coming up over the year, and we're going to be having our yearly conference in June in Melbourne. A little bit later in this episode, we're going to be having one of our guest speakers on, Asha, but we'll get to that in a little bit. As I said, we're going to be chatting about careers tonight. So Adam, why exotics? Why did you get into it?
It's a very good question. I've always been interested in the weird species. So I always remember wanting to be a zookeeper when I was young. My mother, rightly so, encouraged me to focus on the veterinary side of things, which for now I'm very thankful for. Um, I went into dog and cat practice as an initial student many, many years ago. Decided that dog and cat veterinary nursing wasn't quite for me, so did the most sensible thing in the world and legged it halfway across the world to Australia on a gap year. And was very lucky to work with some very interesting places and some very interesting species, which convinced me that returning to veterinary nursing, but with more of a specific element, was much more up my street. I was zookeeping over in Australia. I came back, did a bit of zookeeping here, but then took up a student position and then obviously became a qualified registered veterinary nurse here in the UK, and then took over a head nursing role, and then very lucky to be on an exotics full-time position, of which I'm now the head nurse of the hospital for, wanting to work with weird animals outside of the dog and cat. And honestly, for me personally, I probably wouldn't be doing veterinary nursing today if it wasn't that in some way, shape, or form. So
I feel like that's kind of across the board. People in exotics, once they get there, they think, I'm not going to work with cats and dogs ever again.
yeah,
And I'm much the same. I just really like that challenge as well.
yeah, no, absolutely. And obviously, you have your own inspiring career path outside of exotic veterinary nurse training. So I think it's only fair if I have to share why I did it.
So when I was 4, I watched a documentary about a vet nurse bottle feeding a baby gorilla. And I decided that very moment that I was going to be a zoo vet nurse and feed the baby gorilla. Unfortunately, I haven't been able to bottle feed a baby gorilla ethically. Probably not going to happen. But from there, all I wanted to do was work in a zoo. And then when I became 17, I did my first volunteer stint at Australia Zoo and became a vet nurse pretty much the same year in cat and dog land. And then every time I had annual leave, I'd go and do volunteer work at different zoos around Australia just to get experience and get my foot in the door. Um, and I read a lot of textbooks in my personal time. But it kind of put me in a good position when I was in front of those people that I was volunteering for. I could show them that I did have some knowledge behind me and that was memorable to them. So when jobs did come up, I was sort of noticed when I put in my resume, and that kind of snowballed, and I ended up getting a few short stints at one zoo, a few short stints at another one. And then the paid jobs just kind of came in. Once you get your foot in the door, it feels like all the doors are open for you. So it was something that I always wanted. And I knew that going into exotics was a step into the zoo world. That doesn't mean that I don't love exotic work. It's always going to be a huge passion for me.
No, absolutely. And I think it's interesting as well because obviously we are in very different countries, to say the least, with time differences, let alone everything else. Your experience of exotics and zoos, I think, is a little bit more divided than perhaps my own. So certainly within the UK, with those legislations, whether people agree or not, can be a little bit loose with some of the species that you can keep individually as pets. So some of the things that we see, for example, as a domestic, so a meerkat, something like that, are very much more along your zoo only animal species, which I think kind of highlights the opportunities are there, even if potentially they're a little bit further afield. There are opportunities in different places. So definitely voluntary work and putting in and making yourself stand out is always going to be good, not necessarily just within the home country as well, because definitely within your, it's obviously a great experience. But I think for some people listening, if they're thinking, but it's so hard to get into, definite further afield sort of thing, because it's a very useful way of gaining more experience and knowledge, I found personally.
Yeah. A lot of people that I have spoken to when they're wanting to get into exotics early in their career, they would go to the UK because
Mm,
there are so many different species in the pet trade that we're obviously just not going to get here in Australia. That's why I love that you and me are teaming up for this podcast because we have such a different perspective on the same topics.
yes.
What would your advice be to someone if they came up to you and said, I work in cats and dogs and I really want to work with exotics? How do I get there?
It's a very common one. I'm sure you've been asked it lots and lots as well.
Hence why we're
Um,
here.
I think, firstly, anybody ever asking, and for me personally, I'm sure Sam's exactly the same, is you should never feel embarrassed to ask that kind of question. Ultimately, we're very lucky in the roles we do. Not to say that we don't put in hard work to obviously get where we are, but we are very lucky to be in a niche thing. Veterinary nurse training is a very good resource base to help meet like-minded people in that regard. In terms of specific things, I think you've already touched on it. Effectively putting money where your mouth is, going above and beyond to make yourself stand out, gaining that experience, gaining that knowledge base so that when a role opportunity does come up, either your name is already known, you've already worked with them a little bit before in a voluntary capacity, or you've already got base knowledge to be able to go, okay, I can do this, I have done this, therefore I'm going to be that little bit further along perhaps in some of the other candidates. Now, if you truly want something, then you need to, unfortunately, in this industry, very much spend a lot of free time pushing for it and kind of gaining that experience knowledge. And it does pay off eventually. How long it takes to pay off, how long is a piece of string, but I think it will eventually pay off if you're truly passionate about something. Definitely wildlife and voluntary nursing is very popular over here in the UK, and I think it's very similar in Australia from what I've seen and spoken to people, and it gives you a good range of species, but also it does help you actively contribute back to a very important key area of conservation and rehab, which I think is always great. So there's a lot of projects, perhaps more accessible for those in the UK, where you do like a week trip or 2 week trips and paid volunteership. They are good and they do provide a service, but obviously if you get 10 CVs with that same thing, the one CV that doesn't have it on and has something else, probably going to stand out a little bit.
Yeah. You touched on something really important at the start of that when you said, ask these questions.
Mm,
Don't be embarrassed. I get asked this question so many times, but I'm not excited to answer it. I want to help people get where they want to be. I am a huge believer that if you want something bad enough and you're willing to work hard enough for it, you will achieve it. So when people do ask me, how can I get there? What can I do? This is what I've done. Where can I go to now? It really excites me because it's the start of their journey and they're asking the right questions. It's people that want something but don't ask how to get there that are never going to get there. So yeah, please ask me. Volunteering is such an important thing. I did a bit of a survey of vet nurses and wildlife nurses last year for my conference talk about how to become a zoo nurse. And the people that I surveyed, 99% of them said that volunteering helped them get that position. So it is such a valuable thing to do. And also the experiences that you get doing it are just going to be second to none. Like I got to hand feed my first green sea turtle when I did volunteering. You are going to remember forever. Yes, there'll be a lot of, breaking up poo, but there is going to be so many important things that you experience during them. So don't ever discount that. Um, it's really important to network with people and not just trying to spruik my conference, but any kind of conference. Make sure that you go up to people and you talk to them. There's no point being shy. I'm the biggest introvert you'll ever meet, but there's no point being shy at these things. These are the places where you're going to meet people and hear about different volunteering opportunities as well.
No, absolutely. Definitely agree. And I think that's a really valuable point is definitely, even if you are naturally shy, and it's not saying, oh, you must all be confident. Like Sam is, as she said, is obviously naturally shy. But if you remember in your head that you're naturally shy, but also probably the person you're trying to speak to is naturally shy,
Yeah,
you have to take the first breath. And even the conference speakers and the webinar hosts or whatever they are doing, they might not always be the ones to make the first opening gambit of conversation sort of thing. But if you get them talking and stuff like that, I've never met anybody that's not been receptive to a bit of friendliness ever in the industry, which is nice. You ever don't meet somebody that's receptive to friendliness, and that's more of a reflection on their individual personality and definitely not person conversation.
definitely. So I actually did a survey last year when I was doing a presentation on how to get into becoming a zoo nurse. And most of the people that I surveyed said that it took between 10 to 13 years to get into the zoo industry. So I just wanted to highlight that, if you don't get where you want to be within the next 6 to 12 months, it doesn't mean you're not going to get there. It just means that you've just got to keep working there. Do you find that that's sort of the same time frame for exotics?
Yeah, absolutely. I haven't surveyed it quite as in depth as yourself. So our kind of the final step, as it were. Like I said, we do have an overlap with zoos, so perhaps our exotic stuff works a little differently. But certainly for me as an individual, I left the veterinary industry because I didn't want to do dog and cat, and I returned with it purely with the aim of getting into exotics. So the gap between me leaving and returning to the veterinary was probably, I don't know, 6, 7 years. But during that time, I was still doing a lot of employment as zookeeping, but getting a lot of experience with wildlife and other places. So that when I did decide the return was for me, um, I was already within a very well positioned place, move into exotics. I think touching on what we discussed before, individuals shouldn't put us on pedestals and not perceive us as some kind of amazing people that have got there through just because we were born to do it. I personally find like when people go, oh, you're a mate.
No,
Okay, I
no,
don't like,
definitely.
and I think people, and just by speaking to us, hopefully people get that idea, but also that we're not like, but also realizing then that they're not doing themselves a disservice. They really want something like we say, and they can achieve it. It just requires a lot of hard work, a lot of dedication. And yes, to a certain extent, luck is going to be playing a factor, being in the right place at the right time, but being prepared for when that luck comes up is going to serve you in better stead than just hoping. Yes, exotics can take a long time. Some people I know, they walk straight into it. And I've hired a few nurses that are relatively new into the veterinary industry because they are very passionate. And I think passion is the number one. You can never teach passion. You can teach skills, you can teach knowledge base, you can work with them. You can never teach passion and dedication to wanting to achieve the best for the animals. Um, and whether that's exotics, wildlife, zoo, or small animal farm, whatever it may be, your passion is your passion. And I think it's good to own it. Don't be embarrassed by it. Just because you might be the slightly weird exotic nurse or the zoo nurse or whatever it may be with the interest in a bizarre species, like just own it. Be that weirdo, and it will serve you in good stead because people very quickly learn that you're the weirdo that wants to actually help, and they'll bring you the cases that you might want to see, even if you're not directly full time in the industry yet. And I think own the weird.
I really love that because, yeah, I have really kind of come into my weirdo in the last few years and just accepted that I am the weird exotic
Yeah,
person. That's a fun place to be. It's
yeah.
good. There's nothing wrong with that.
No, a conference every year, sorting podcasts, got 4 books on the way. Like, funny enough, the weirdo sometimes works. So definitely, I think it's, yeah, own it.
Now, Quickly, is there any qualifications that people can get that would help them in their journey towards becoming an exotic nurse?
Within the UK, our setup is a little bit different for veterinary nurses as a whole um, at the moment compared to Australia. But I believe last time I was in Australia, you'll be able to say it was changing somewhat. So within the UK, it's registered veterinary nurses are the ones that gone through all the training, whether through degree or release training, mm, which is the more hands-on route. You get certain criteria, you pass lots of testing and practical examinations, and then you have to maintain certain levels and you could go onto a register, very much like a human nurse. Um, in the UK, the title of veterinary nurse is not only the registered veterinary nurse that's protected. So that's step one. And then step two is there are further qualifications. There are certificates, which I'm no way associated with them, but there is been a singular exotic certificate provider that's been pretty much the niche on the market for an extended period of time. And I certainly encourage all my team members to go for it. But there are more courses becoming more and more available to individuals now. The veterinary tech qualification, for instance, is not too well within the UK. I think it's got exciting promise for the future. And certainly there's postgraduate qualifications now within exotic specific veterinary nursing where there never was before. And exotics is just not about knowing about exotics, as we well know, like anesthesia is an integral part for me. Yes, I have my exotics, but I've also then done my qualification in anesthesia. So if you are more aligned with seizure or medicine or hospitalization or something like that, there's qualifications which, even if seemingly not directly related to exotics because it's primarily aimed at small animal veterinary nurses, there's still very useful information which you can then link to your exotic or zoo or wildlife, whatever it may be. Uh, Is Australia a very similar setup, or is it kind of different at this moment in time?
Yeah, so we don't have the protected title. We do have one state, WA, they do have the registered veterinary nurse title, but the rest of Australia, registration is voluntary,
Mm.
but it is kind of heading into the right direction. But qualification certificate 4 is the basic minimum, but there isn't any exotic qualification in Australia. Did the course that you were mentioning from the UK, it's available online. Highly recommend it to everyone. They're certainly amazing for giving you a base understanding of exotics, but the cat and dog training that we receive should not be discounted. I have so many people saying, I don't want to learn about cats and dogs. I just want to get into exotics, but you're missing out on this huge wealth of knowledge. So don't discount your time spent in cat and dog land as just trying to get out of it. It's definitely valuable as well.
Absolutely. And like I touched on another one of my nursing colleagues. She has a passion for EC, which she's bought from dog and cat land into exotics. There's not always the best um, references for ECG and exotics, but she's passionate about it, and she's passionate where she's encouraging me to get some equipment for her, which she can use, which she's, using more and more, which I think is great. Like,
Yeah.
bring new ideas just because there's not a reference or there's not too many reference values. And who knows, you might be the next one right in the next article about different references and certain things, like Sam says, definitely bring the skill sets across. Exotic nursing is not different from dog and cat nursing other than the fact of the species we work with. But ultimately it's veterinary nursing and we will all be using variation, same equipment, the same monitoring and trying to achieve the same level. So bring the skill sets. Don't think it's wasted at all. But it's what you do with those qualifications afterwards. Even if you do achieve your goals of going into exotic, zoo, wild, whatever it may be, you then can't stagnate because you need to continue to strive for improvement in animal welfare and animals under your care. And so you should be thinking, now that I've achieved my goal of being in the industry I want to, what contribution can I now provide to the long-term animal care thing? You might be the next person that's setting up books or whatever it may be. And, I think if you thrive in ECC kind of work, I think you'll do well within this exotic zoo ground. If somebody has good experience with ECC, I do keep an eye out for it because I think if they can handle those situations, exotics or zoo are very much on the fly. There's not much routine.
No.
What are we going to fix it? And So in my personal experience, I think ECC is an excellent way as well, outside of necessarily just a qualification or do the ECC qualification or something like that.
Yeah. ECC was where I learnt the most amount of skill, definitely. So another question I wanted to ask, what do you see for the future of vet nursing in the next 5, 10, 15 years?
Yeah, I think it's a very exciting time. I believe Australia is going through some very similar processes that UK has been trying to do for a little while in terms of protecting the title of veterinary nurse, whether it's exotic or small, domestic or farm, whatever it may be, is an incredibly important step forward. And everybody should be pushing for to know certain standards are going to be met when you're taking an animal or whatever the practice. But I think it's exciting. I think veterinary nursing is becoming more and more accepted as a profession where they do actually contribute. Now, I'm very lucky in the hospital I work within that the veterinary nurses do have a very large say within the work that we do. We do get on with the veterinary surgeons very well and so forth. However, I know that in other places that may not be the case, but I think it's shifting across all things, whether it's exotic or zoo or wildlife. I think it's all shifting finally to recognize that veterinary nurses are definitely an integral of clinic, hospital setup, whatever it may be. I'm a big advocate that no matter your role, no matter how small you perceive your role to be, you're still integral. So that's veterinary surgeons, veterinary nurses, but also animal care assistants, kennel assistants, reception team, back office workers, whatever it may be. Without each other, you just simply can't function. And I think that's the best mindset. Every nurses are actually beginning to recognize their own self-worth, and they are doing things like starting conferences, writing 4 books, lots and lots of things where they are beginning to recognize their self-worth. You can't push for improvement if you don't recognize what you can bring to the table. Whilst traditionally vets have always been seen as the smarter ones, they are with more degree-based sort of forms of study, traditional formats going for university and so forth. But veterinary nursing is still a very, very smart industry to be within. I never like to hear that some people feel less smart because they're not a vet over a vet nurse. And I think it's important that on those things, we politely just push back and go, no, I like to be a vet nurse because X, Y, and Z. But I
Just with you saying that everyone in the team is integral, it's kind of become more obvious with the short staffing and, even with COVID, you really felt when the admin person wasn't there or the vet nurse wasn't there or the other vet, it's everyone makes up that team and we are a vet nurse. It's so important that we never ever say we're just a vet nurse. Even a few years ago, my extended family said that they'd really like to see me go back to be a vet because vet nursing was beneath me because I'm too smart. And I decided in that moment that I was going to prove just how much a vet nurse could do. Um,
only the vet can fix the issue. When in reality, we all know that veterinary nurses can just as play a very large part. Now, obviously, you can't do surgical. Who's the one that's keeping the animal safe and under anesthesia, for example? And I think the more owners get educated, better.
I also noticed that there's been a shift in terms of exotics. When I first started, there was no exotic only clinics. And now, even in the last few years, we've had so many pop up around Australia because the amount of people owning exotic pets has just grown exponentially. And the amount of money that people are wanting to spend on it has grown exponentially. What is your dream animal to work with?
I've been very lucky to do a few of my dream animals. UK native, they all know that if they get an otter in, then I will get a phone call because I do love, I think I've always said tongue in cheek that if I ever got to do a polar bear, then that would be me done. I'd be retired. I might as well just up and go home. I don't think I could get any better, to be honest. But yeah, the funniest question I've ever had, actually, just to go slightly off, is when I was still zookeeping and they said, oh, if you could work with any animal alive or dead, what would it be? I was like, well, it's going to be a T-Rex.
Oh,
But
yeah.
100% a T-Rex. But
Yeah.
obviously in today's live reality animals, I think it happened. I mean,
Yeah.
what about yourself?
Crocodiles are my thing. I love them. I had a chance to do one anesthetic a couple of years ago and I have some photos of me holding onto the top door rope and I had the most ridiculous smile on my face. But yeah, if I could do more of them, I'd be a very happy girl.
Something with teeth is always the way forward.
So here's our first guest speaker for our podcast on episode 1. This is Asha Yeoman. Welcome, Asha. Asha used to work with me many years ago, but I was really excited to have her on here today because she has a lot of experience in leadership. And because we're talking about careers tonight, I just wanted to sort of get you on and ask what is your background and how you got into leadership?
Thanks, Sam. I'm actually really excited to be here tonight. I guess my background is, as a full disclosure, I don't do anything in exotics. I'm in ECC, but my background has been solely in ECC and then progressing into leadership from there. So I have been in vet nursing for about 20 years now. So it's been a really fun and exciting progression for me, stepping into not only clinical leadership, leading a team at the hospital that I work at, but also some industry leadership through our industry or representational organizations.
So I actually thought that was a really interesting take to have a guest speaker on who isn't in exotics on an exotic podcast. But the reason I did that was because I wanted to kind of get your opinion on the world of exotics. Do you feel that the attitudes towards exotics has changed in the last 20 years? And where do you see things going with exotics in terms of like a general practice or an ECC cat and dog facility?
I think it's really come a long way, especially in the last sort of 10 years. I think prior to that, there was a lot of mentality, at least where in the practices I've been in, there was a lot of mentality of, we can do something very basic and then we're going to refer the patient. Or querying, does this owner want to invest our consult fee on what would be, I hate saying it, but, a inverted commas, lesser patient, because some people can't see that others may have that same emotional attachment with, say, a goldfish or a little budgie. But the mentality has really shifted, I think, across the board, and people are seeing that owners out there are really valuing their pets, regardless of whether they're a domestic dog or cat or a bird that's been in a cage, that they're valuing them as an equal type of pet. And I feel that a lot of nurses and vets as well, regardless of what setting they're in, they're pushing themselves to learn a lot more about being able to provide care for these animals, even outside of that exotic specialty practice. And that's why organizations that offer training not only towards an exotics focused practitioner, but towards people who, like myself, who don't work in exotics, but really want to expand in that area so that I can still provide an adequate level of service to these patients, despite that not being my primary focus.
That's really, really good to hear that is how things are kind of moving towards realizing that people can have the same emotional attachment to any animal. That's
Absolutely.
Yeah.
I think it's a really good and honest answer. And I think by being so good and honest, for which Sam and I as well, I think it's helped put the exotic pitchforks away for people judging you that you're not with exotics. So yeah, I think you've calmed down some of the things. So I think it's really good. I think
yeah.
in the UK, for us, for instance, the rabbits are arguably the third most common pet, to the point where, if I'm honest, I'm beginning to personally believe they shouldn't even be classified as exotics. They should more align with dog and cat care. I don't know how you guys feel about that from your side, but by their sheer popularness as individual animals, is that what then moves the definition from exotic into something else? Or is it some other definition? Perhaps it needs to be reviewed at some point.
Yeah, it's a really good question, that one. But I feel, Asha, correct me if I'm wrong, rabbits are probably the third most popular pet in the industry.
I definitely think it's probably the next most popular out of dogs and cats. I'd say working in, domestic small animal practice, that we definitely see more rabbits as opposed to anything else. But that could also be more skewed because they're a pet that is more commonly seen because it's less referred, perhaps. I would say that, maybe there are an equal number of people that are owning reptiles and birds, but they're learning very quickly that they need to find specific practices to provide care for them. And so they're less likely to perhaps come in. I don't know if that impacts, the demographic of what we're looking at in regards to which would be the most commonly owned, but we'd certainly see an increase in rabbit. That's for sure. I was actually having a conversation with a colleague recently, and we purely around the triage board, and we sort of highlighted the difference that 15 or so years ago, when we would record our patients that were coming in and we put them on a triage board or on a scale or somewhere where we'd be communicating to the vet the order of the patients that needed to be seen through emergency, that it was almost an automatic thing that the dogs and cats would be prioritized higher in that scale. And then we would say to them, oh, we've also got a rabbit and a bird. Whenever someone who's willing to see that is happy to see that, they're also here. Whereas now when we look at our triage boards, those patients are being categorized in order of urgency in equal consideration to the domestic pets that are coming in. So it's not uncommon to have, cat, dog, rabbit, dog in our list to be seen. And we're not deprioritizing those pocket pets anymore. And we're not sort of saying to our vet, who's willing to see this? Can you see it? Can we squeeze it in? It's now framed more, there's a rabbit that's next and I need you to see that.
That's excellent. Now, another reason we got you on here, Asha, is you were actually talking at the 2025 Exotic Vet Nurse Training Conference. So you will talk beyond the shadow shift, clinical teaching strategies to create the team you need. Can you tell us a little bit about your talk?
I'm so excited. I've never been to an exotics only event like at all before. And we had that conversation, didn't we, Sam, about how
Yes.
sometimes there's that mindset where I don't belong here because I'm not an exotics nurse. So I'm really excited to be able to come and be the token non-exotic nurse presenting. But the reason that I sort of reached out and proposed having this topic in your program is that it's something that I feel is really important and it's quite relevant to the exotics field, because what I'm talking about is the importance of effective clinical teaching. So effectively teaching someone that you have in a clinical environment. And when it comes to something like exotics medicine, it's one of those, I guess, lesser taught fields. So it's not necessarily something that is a huge component of formal education when we're teaching our vet industry in general. It's certainly sort of framed as a smaller component of that education. So we have a lot of clinical team members who don't necessarily have the required level of experience or knowledge and understanding in this area of medicine when they're going to these exotic practices that they might want to work in. And the only way effectively that we're going to get really skilled clinicians in these practices is to teach them. We need to bring people in, we need to teach them and support them. And if we can't effectively teach someone, then we're not going to be filling those skills gaps. We're not going to have these experienced exotic clinicians and nurses because they're not getting the training that they need to fill those roles. So effectively teaching someone when they come into your practice is really vital to be able to have these sorts of nurses that have those skills that you so desperately need, especially at the moment when here in Australia we have such a notable skill shortage in our industry.
I've certainly noticed that going into exotic, and probably even more so with zoo, that you have to rely on the people you work with to train you, because historically there's been no training facilities. And if we don't have that support and training, we're not going to succeed.
I think it's a very fair a question and a great answer, to be honest. I think a good leader always makes a difference in this industry. We all know the industry can be incredibly challenging and tough at times, either through caseload or other factors. I mean, me and Sam already touched on Asha just before you came on, about, the kind of how veterinary is seemingly worldwide at the moment, unfortunately. So I think having a great leader makes all the difference. If you're having a bad day, a good leader is the difference between a really bad day or keeping you on an even keel of a bad day sort of thing, and equally for a good or a really great day. Um, I think from leaders' perspective, certainly from mine, I believe it's not quite our duty, but almost it should be a leader's duty to progress the team. Like I feel once you become in a leadership thing, you do have to go for a mental shift. And certainly for me personally, I found that really effective. You are no longer about self per se and the overall effectiveness of the clinic. You're now about the team that you're representing them fairly and giving them equal opportunities to go beyond you. In my opinion, I think if any one of my guys achieved more than me, I wouldn't feel jealous or anything like that. I'd feel very happy that I played a small part within that development for them. And then that progresses the career industry. And I think perhaps maybe some of the older style leaders don't necessarily agree with that.
I was actually speaking with Asha today when we were talking about her coming on this podcast. I was saying, there's a difference between leaders and managers. Leaders are not trying to become the best nurse they can. They're trying to create the best team they can. And I completely agree with you. If someone I've trained has gone and progressed further than me, that is the best thing ever. That's the most satisfying thing you can have.
No, absolutely. And I think the way you've worded it in terms of not being a manager, but being a leader, I think is a great shift of perspective.
So what are the top 3 takeaways from your presentation?
Um, oh goodness. And I feel like it's one of those things as I keep working on it and I've sort of going, there's all these different focuses on what do I want to highlight the most. I think the key focuses will be, um, I want people to take away from it a sense of how you can effectively teach someone. So giving them the right balance of challenges and support to be able to build themselves and grow, how to give effective feedback. Because feedback is something that can be really positive or really negative depending on how you give that. And then just an understanding of why it's so important to be able to teach people in our workplace that it's not, um, a me versus you thing, or like you guys said, it's not about being jealous of someone who might then achieve goals before you or progress faster than you. It's about why it's so important to support people and teach them so that you can all really work together to achieve that common goal.
The other
I
question
think
I want to ask everyone is, how do you practice self-care?
I like to have a good balance. I like to be able to have time to do things that have nothing to do with my career, which I know is really hypocritical because a lot of my hobbies are all related to the vet industry. I do like to, make sure that when I'm checking out of work and I'm checking out of everything else I'm doing, that I am spending quality time with family and quality time with my pets.
Well, thank you so much for coming on. We really look forward to your talk at the conference. It's coming up now in about 6 months' time. Thank you so much for joining us, Asha. And then that brings us to the end of our first episode of Exotic Ward Conversations. I wanted to say thank you to our guest speaker, Asha. It was really valuable having someone that is non-exotic based and hearing their perspective on things. And I really wanted to say thank you, Adam, for joining me as co-host on this very scary venture.
Yeah, no, thank you very much, Sam. I'm sure myself and the other listeners appreciate the honesty and some of the answers that you've been given to some of the topics. And I think that's always appreciated. And thank you for having me. I know you have a large selection of people that you could be choosing from.
And thank you all for listening on our first podcast. And we'd really like to hear what you want to hear from us as well. If you've got any topic ideas that you really would like us to discuss. But next week, we're actually going to be talking about biosecurity, which is pretty topical at the moment, given that avian flu is spreading around the world. So thank you, and we'll talk to you next time.